Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, it's normal to lose hair. We can lose between 50 and 100 hairs a day, often without noticing. Hair loss is not usually anything to be worried about, but occasionally it can be a sign of a medical condition. Now, some types of hair loss are permanent, like male and female pattern baldness. Now, this type of hair loss usually runs in the family. So, to discuss on this entire topic, we are being joined today by Dr. ARUNA Devi, specialist in aesthetic dermatology, dermatosurgery and cosmetic gynecology. So, not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Well, thank you so much, Dr. ARUNA Devi, for joining to Good Life, the health show. So, today the topic which we have taken has become a matter of concern, not only for the females, but also for the males as well. We are talking about hair loss. Now, doctor, if you would start with what is hair loss? And is there a difference between hair loss and hair thinning? And when is the right time to be concerned about it and see a dermatologist immediately? What do you have to say?
Well, very good afternoon. What I would like to state, because all of us know, like our hair, our like scalp, it holds about around about 1 lakh of average hair follicle at one time. That is actually a fixed, quantity. Little bit plus minus will be there. That is for average human being. Okay. So, and we know about the hair cycle. It is not a static one. We know about the hair cycle. It has got 3 phases. One is growth phase, one is resting phase, and one is falling phase. So, what happens, normally average around 80% of hair, it stays in the growing phase. So, and there is a short resting phase and then the falling phase. So, what happens, one hair follicle, its life cycle is around 2 to 6 years maybe. For that period it keeps on growing and then it goes into a short resting phase, then it goes to falling phase. Then it falls off and from the same follicular that bud, new hair erupts. So that's how the hair cycle keeps on continuing. So that is normal. So average around 50 to 100 hair fall daily without even noticing we lose.
Okay.
But the thing is that there are certain conditions, there are certain conditions where there is excessive hair loss. So many factors are there, some like inside factors, intrinsic factors, some extrinsic outside factors, some environmental factors, diseases, everything comes into play. Like what happens, then there is excessive hair fall, and there is one more condition where there is hair thinning. Usually the hair shaft, it is good shaft is there outside the follicle, but gradually what happens with age, with some hormonal factors, there is gradual miniaturization of the hair follicle. Then hair becomes thinner and thinner and thinner, and ultimately the terminal, the adult hair, it becomes a baby hair or the vellus hair, and ultimately it falls off. So that is hair fall, and then we will have to prevent those things. So that is hair thinning. And hair loss, actually this is when we should worry, like when it is normally losing our hair 50 to 100 going on, sometimes plus minus with environment, with weather conditions, that is normal. But if it is excessive and it is rapidly falling, then it is a case of concern for us.
Okay, and so that is the time when one has to go and see a dermatologist.
Hair regrowth, no need to worry. Yes, yes.
Okay,
yes.
okay.
If it is growing spontaneously at an average rate, no need to worry. But if it is not growing and if you need a volume, the volume is not proper and it is not growing properly like as it was before, then it is a case of concern.
All right. Now, doctor, there must be numerous causes and numerous common causes of hair loss. Might be hormonal cause or because of the weather, or there might be other reasons as well. So if we talk about the basic causes of hair loss, so what would be that?
Yes, there are so many conditions where actually excessive hair loss can occur. Namely environmental, like extremes of weather, pollution, dusty weather, then extremes of temperature, then the workplace environment, all those actually matters. Then excessive sun exposure, okay, those water quality.
Okay.
Then comes to local conditions, say like some nutritional deficiency, malnutrition, anemia, then the thyroid condition, hypothyroidism, then vitamin deficiency, then the hereditary condition, age, stress, anxiety. Okay, then most importantly, postpartum, post-delivery and lactational period for women, and then some local causes like some infection over scalp, like fungal infection, seborrheic herpes, then some other conditions like diffuse alopecia, like localized alopecia areata,
Okay.
then some other systemic conditions, diabetes, then SLE we call systemic lupus erythematosa, psoriasis, then so many other conditions, then some cancerous conditions, then medications like chemotherapy, immunosuppressants for a long time. So those are some other important factors. They in fact cause hair loss.
All right.
And there is another factor, most importantly nowadays, like post-COVID. Post-COVID is a very important factor for hair loss. And another I would like to highlight about the hair styling products and the OTC hair care products. Nowadays it's the OTC products are too many OTC products you have to choose, and you have people usually go for those things, and too much of hair styling, straightening, curling, all those actually hamper the hair growth.
Okay, doctor, we'll come to that. We'll come to the products also.
And there is
as
another
well.
Condition like,
Yeah, doctor, we'll come to that. But before that, I would just like to ask you, Dad, about the male pattern hair loss. We are only talking about females. So male are more concerned nowadays than females. All right, doctor, we'll come to that. But we have a caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello.
Hello.
Hello. আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় মোৰ মানে ৰিসেন্টলি বহুত হেয়াৰ ফল হ'ব লৈছে যাৰ বাবে মেডিসিন খাব লাগিব নেকি
হেল্ল' হয় আপোনাৰ কোৱেশ্চনটো শুনিলো হেয়াৰ লছ বিভিন্ন কাৰণত হ'ব পাৰে হয় মই এইমাত্ৰ ক'লো বিভিন্ন ধৰণৰ কাৰণত হেয়াৰ লছ হ'ব পাৰে সেই বস্তুটো যদি স্কাল্পটো ভালকৈ চোৱা যায় আমাৰ এটা ডাৰ্মোস্কোপ বুলি পেলাই আমাৰ এটা মেচিন আছে ইনষ্ট্ৰুমেণ্ট আছে সেইটো দি হেয়াৰ ৰুটটো আৰু স্কাল্পটো ভালকৈ চাব লাগে যদি কিবা ডিজিজ আছে সেইমতে ট্ৰিটমেণ্ট ল'ব লাগিব আৰু যদি নিউট্ৰিচনেল ডেফিচিয়েঞ্চি হৈ আছে বা গ্ৰোথটো ভালকৈ হোৱা নাই কিবা মানে অব্লিগেশ্যনছ আছে সেইখিনি বস্তু আমি কাৰেক্ট কৰিব লাগিব তেতিয়াহ'লে আপোনাৰ হয়তো মেডিচিনো ল'ব লাগিব পাৰে সাপ্লিমেণ্ট ল'ব লাগিব পাৰে বা স্পেচিফিক যদি কিবা কণ্ডিশ্যন হৈ আছে স্কেল্পত সেইটোৰ কাৰণে হেয়াৰ গ্ৰোথ হোৱা নাই সেইটো ট্ৰিট কৰিব লাগিব সো বেটাৰ আপুনি কোনোবা এজন ওচৰৰ ডাৰ্মাটলজিষ্টক দেখুৱাই পেলাই ভালকৈ ট্ৰিটমেণ্ট ল'লে আপোনাৰ কাৰণে সুবিধা হ'ব
হয় Thank you.
Right, thank you so much for calling. Okay, doctor, let's talk about the male and female patterns. So, of course, there is a difference between the male pattern hair loss and the female pattern hair loss. So, if we talk about the male pattern hair loss, what would be those?
Well, actually, this is a worldwide, problem. Most of the hair fall in male specifically is because of this male pattern hair loss. This is actually genetic. It is also androgen dependent. There's a hormone androgen. This is a main factor, and it is also hereditary. It is proved. Okay. So what happens in case of male there is recession starts initially in the temporal side then from the frontal then the vortex and usually gradually what happens that this recession extends up to extending up to the whole frontal and the temporal and the vortex. This we call in medical term androgenetic alopecia, and it is around say in worldwide around 70 to 80% of problem is because of the male pattern hair loss, and this is medically it is, the pattern is called, Hamilton pattern of hair loss. So there are several gradings, grade 1 to grade 4, 5. So accordingly we will have to assess and we will have to treat it. And this is because of the hormonal, influence, because of the excessive sensitivity of the hair follicle towards the androgen hormone, and also because of the hereditary condition. Okay, it may start as early as from the teenage years, say 18 to 20 years it can start, or usually it starts from 35 years onwards. That's it.
Okay. Now, doctor, is hair loss also related to some health problems in the person?
For female also, okay. Yes, I have already told you, like hair loss, if there is some systemic conditions, we have already discussed, like those diabetes mellitus, hypothyroidism, anemia, nutritional deficiency, those conditions and some chronic debilitating conditions, these conditions may lead to hair fall.
All right. Now, if we talk about the female pattern of hair loss, then doctor?
Yes, female pattern hair loss, this is a counterpart of the male pattern hair loss.
Okay.
This is also because of the genetic condition and the hormonal issues. But some other factors are also related here. The stress and the pregnancy issues, those things are also comes into play. Like in female pattern hair loss, it is not very much obvious in the early part. So that's why what happens, females in early stage of hair loss, they even don't know they are losing their hair, okay, because it is a diffuse balding. Gradually like there's a round pattern or some Christmas tree pattern of hair loss. When this is very obvious in the later stage, then only a person come to know, like she is actually having female pattern hair loss, and they come for treatment purpose. They become concerned. Otherwise, in the early stage, they even don't know whether they are having actually hair fall or not. They may be thinking it is normal for them.
It's normal for them.
That's it.
So as soon as the treatment is started, the things will be more properly done.
With age, it becomes very obvious.
Absolutely, doctor. Because like we have to rule out the exact problem of the hair loss. A proper diagnosis is very important for this, isn't it, doctor? A proper diagnosis, a proper treatment is very important, and treatment will start when a proper diagnosis is done. What is the root cause of hair loss? Is it a genetic? Is it related to some health issues? Or is it the normal features we are just going through the phase? Because nowadays we have seen the lifestyle activity has also changed. People have become busy, and many products or many outsourced products are also being used. So a lot of like cosmetic products and things are being used which have been in the market, and which to choose, which not to choose, is the best person is the dermatologist to tell you that, to guide you in a right place, isn't it, doctor?
Yes. If we can identify the cause at the early stage, and if we guide the patient properly, if they take the treatment properly at a proper time, and regularity of the treatments is also important, then obviously this is very much controllable.
Okay.
This condition.
All right.
Whether it is hereditary hair loss, androgenetic alopecia, or whether it is hair loss due to some other factors. If we can find out and treat it early, then it is it can be well controlled.
Okay. Doctor, we'll have more conversation, but right now we'll have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on the topic hair loss. Now, doctor, coming back to you again. Earlier to break, we had an idea about hair loss and what is hair thinning, which is the right time to see a dermatologist. Now, doctor, if we talk about the female part, nowadays what we have seen is a lot of products are being used, which is available in market, which to choose and which not to choose. Now, talking about how to care for damaged hair, the ones who are using straighteners for a frequent number of times, what would you like to tell on that?
See, those hair straightening products or hair curling products, they actually do what? They break the disulfide bond in between the hair follicle, the follicular shaft, the cuticle. They break those cuticle, they break those bonding, and then the hair become damaged. Obviously, it is broken, so it is damaged. So what we have to do, we have to be very careful. It should not go into the scalp directly. It should be well away from the scalp, and it should be advised that it should be done not very frequently, because it is going to damage the hair permanently. It's very difficult once that disulfide bond is broken. It is very difficult to again repair it. There are so many hair peptides are there, like vitamins are there, some components are medicated components are there. We apply those things, but still we cannot prevent the damage permanently. So it is advisable to choose to go for those procedures we should avoid those as much as possible. If
doctor,
we want a good lock of hair, and we should.
So you have asked to avoid as much as possible. You have asked us to avoid those straightening products or the curlers to as much as possible. But I would like to give my example to you, or my fellow colleagues' examples, that we are in the profession that every day we have to take care of our hair. We have to do a lot of styling, and so that we look good on screen. So for that, numerous number of we have to use the straighteners, curlers, or the hair products which we want to avoid, but we can't avoid. Now, for us, what suggestions you would like to give of the other ones who are in media?
Okay. So always apply some good quality, usually medicated hair serums are available nowadays. So try to apply those before going for straightening, and for straightening also don't take too much of temperature. Temperature should be very minimal. Minimally effective temperature should be applied, and the hair serums, the medicated serums should be applied regularly over the scalp and also over the hair, and as much as possible apply some medicated shampoo and conditioner to protect them, and medicated colors are also available. Those you can also use, and in the other way around, you will have to protect the hair from damage as much as possible.
As much as possible.
So some other serums are also available before applying the straightener. You can apply those serums to protect the hair follicle. So those also can be useful.
All right. There must be some basic care also, doctor, for the hair loss. Now, what are those basic care if people want to opt at home itself? If not necessary, if it becomes important that one has to go and see a dermatologist only, that's a different case. But at home, what are the basic care that one can do to prevent hair loss?
Well, first we'll have to, take care of your diet. Good food, nutrition, balanced food, proteinaceous diet, the nuts and dry fruits. Those are the proteinaceous food I have told you, then vegetables, the rich source of vitamins. Those food, if you take balanced food, then it will affect not only your body as well as your hair. So the hair will get good quality of nourishment, and if you have some deficiency, you feel weakness, you go for some vitamin supplements, you go for some iron supplements if you have anemia. So that's it. And the oiling. If you apply like say coconut oil or sesame oil or almond oil, those are good for hair because those have long chain fatty acid and it is actually good for your hair. But if you have dry hair, you can apply the oil, massage it and keep it overnight. But if you have oily scalp, oily hair, then you don't have to keep it overnight. You just keep it 2-3 hours before shampooing, and always use a mild shampoo which is not harsh for your hair and your scalp. And take good food, take stay hydrated. That is also important for your skin as well as for your hair, because your hair also needs some hydration, right? So that is important. And avoid too much of sun exposure, because too much of sun rays, UV rays also causes harm to your hair. So those are very important things. Environmental exposure, that as much as you can avoid.
Okay. All right, doctor, we have a caller.
Prevent hair fall or hair damage.
Okay, doctor, we have a caller. Let's take the call. Hello.
Hello. মই আপোনালোকৰ প্ৰগ্ৰামটো চাই আছো। আপুনি কৈছে যে মাইল শ্যাম্পু। মই যে এটা কথা সুধিব বিচাৰিছিলো, মাইল শ্যাম্পুৰ ভিতৰত বেবি প্ৰডাক্ট যিবিলাক আছে, যেনেকুৱা বিনিমি, নহলে জনসন, নহলে মামা আৰ্থ, এইবিলাকৰ শ্যাম্পু ইউজ কৰিব পাৰি নেকি এডাল্টবোৰে, মেল অৰ ফিমেল?
সেইটো ডিপেণ্ড কৰিব আপোনাৰ হেয়াৰ কোৱালিটি আৰু স্কেল্প কোৱালিটি কেনেকুৱা আছে। আমি কিছুমান ক্ষেত্ৰত ইনফেক্ট বেবি প্ৰডাক্টছো ইউজ কৰিবলৈ কওঁ, বাট আফটাৰ 5 years অৰ আফটাৰ 10 years বেবি প্ৰডাক্টছে আপোনাৰ এডাল্টৰ ক্ষেত্ৰত বহুত বেছি কাম নকৰে। বাট ষ্টিল মাৰ্কেটত বহুতবিলাক শ্যাম্পু কণ্ডিশ্যনাৰ্ছ আছে হুইচ আৰ একচুৱেলি মাইল্ড বাট নট নেচেচাৰিলি বেবি প্ৰডাক্টছ। মামা আৰ্থ বা বেলেগৰ কথা মই ক'ব নোৱাৰোঁ, বিকজ দোজ আৰ নট মেডিকেলি প্ৰভেন। আই কেনট স্পীক অন দোজ থিংছ। বাট মাৰ্কেটত কিছুমান ভাল মেডিকেটেড নৰ্মেল হেয়াৰৰ কাৰণে মাইল্ড শ্যাম্পু কণ্ডিশ্যনাৰ এভেইলেবল আছে, দোজ ইউ কেন ট্ৰাই।
All right. Thank you so much for calling at this point in time. I'm sure the viewers who have asked the question must be benefited with the answer. All right, doctor, we have another caller at this point in time. Let's take the call. Hello. Hello,
বাইদেউ।
আমি শুনি আছো, আপোনাৰ প্ৰশ্নটো কৰিব।
বাইদেউ, মই বাইক চলাওঁ, গতিকে বাইক চলালে আমি হেলমেট পিন্ধো। হেলমেট পিন্ধাৰ কাৰণে খুব চুলি সৰে আৰু খুব উঠি হৈছে বাইদেউ। ইয়াৰ কিবা চলিউশ্যন আছে নেকি বাৰু?
হয়, তাৰমানে তাৰ চলিউশ্যন আপোনাক মই ডাইৰেক্টলিটো বেছি দিব নোৱাৰোঁ, বিকজ হেলমেট পিন্ধাৰ লগে লগে কি হয়, চুৱেটিংটো বেছি হৈ যায় আৰু যিমানখিনি ডাৰ্টছ হয়, ধূলি বালি, সিমানখিনি তাতে জমা হৈ থাকে আৰু চুৱেটৰ লগত মিক্স হৈ পেলাই আপোনাৰ সেই যিটো আপোনাৰ উফি বুলি কৈছে ডেণ্ড্ৰাফৰ প্ৰব্লেমটো বাঢ়ি যায়। তো মই এটাই ছাজেষ্ট কৰিম আপোনাক, আপুনি ৰেগুলাৰলি শ্বেম্পু কৰিব লাগিব। পাৰিলেতো আপুনি মেডিকেটেড শ্বেম্পুৱেই ইউজ কৰিব লাগে। আৰু বাইক চলাওঁতে যেতিয়া হেলমেট পিন্ধে, তো হেলমেট পিন্ধাৰ আগতে কটনৰ কিবা এখন যদি আপুনি কাপোৰ বা এনেকুৱা কিবা স্কাৰ্ফ এখন মাৰি ল'ব পাৰে, তেতিয়াহ'লেও আপোনাৰ বহুতখিনি হেল্প হ'ব। আৰু মেডিকেটেড উফি শ্বেম্পু আছে, কেটকনাজল, তাৰপিছতে আপোনাৰ চাইক্লোপাইৰক্সলামিন, পাইৰক্টললামিন, এইবিলাক থকা কল্টাৰ থকা এনেকুৱা শ্বেম্পু এভেইলেবল আছে মাৰ্কেটত, নট নেচেচাৰিলি মেডিকেটেড। সেইবিলাক শ্বেম্পু আপুনি ফ্ৰিকুৱেণ্টলি ইউজ কৰিব লাগিব। আৰু হেয়াৰ কেয়াৰটো ভালকৈ ল'ব লাগিব। আৰু যদি তথাপিতো ডেণ্ড্ৰাফটো কমা নাই, তেতিয়াহ'লে ডেফিনেটলি আপুনি স্কিন স্পেচিয়েলিষ্টক লগত কনচাল্ট কৰিব লাগিব, বিকজ সেইটো আপোনাৰ ক্ৰনিক ডিজিজো হৈ থাকিব পাৰে আৰু অকল আপোনাৰ শ্বেম্পু বা সেইবিলাকে আপোনাক কাম নিদিবও পাৰে। তেতিয়া স্পেচিফিক কিছুমান ট্ৰিটমেণ্ট আছে, সেইবিলাক ল'ব লাগিব।
All right. Doctor, that was a caller who was concerned. Now, it's good to see that males are more concerned than females. Now, doctor, there is also a question which has come to me, is that regarding the grey hair. Now, grey hair has also become a matter of concern these days. If we talk about males, now, what could be the reason for abnormal grey hair before the age group which we are talking about? What would be the reason?
Well, nowadays what we come across very frequently, premature graying, premature candidiasis we call it. That may be genetic, that may be, yes. As early as 18 to 20 years. Usually what happens after 35 years, we see gray hair. But nowadays what we come across, within 20 years, boys or girls, they start graying their hair. This is maybe genetic, usually genetic
Okay.
and to some extent nutrition, because our food already are adulterated food. We are having so much of environmental pollution, nutritional deficiency, stress, those things, and the hair cosmetics, the hair styling products, they also can aggravate the premature graying of your hair.
Okay. Now, doctor, technologies have advanced
like our
nowadays.
hair follicle that has got the bulb.
All right, doctor, we are really short of time. I would just
Hello?
like quickly want to ask you about the treatment procedure. Now, technologies have advanced. There are a lot of equipments to detect the problem of hair loss or maybe other concerns regarding the hair. Now, if we talk about the diagnosis part and then the treatment will be started, if a person comes to you with a complaint of hair loss, so what is the first thing, what would you like to tell on that?
Yeah. Say very shortly, I can tell you those steps. When a person comes with hair loss, we have to first find out what is the cause. If it is because of some disease condition, we have to treat the disease condition first, and if it is because of the nutritional deficiency or some other factors, and when factors, we have to take care of those things. We have some hair supplements nowadays, peptides, some oligopeptides, polypeptides, 𝗟𝗏𝗧𝗏, procappel, minoxidil, those things are also there. Then there's a biotin, calcium pentotheniate, those iron preparations, those can be given to the patient for a specific supplement and to grow the hair. They actually help. Omega fatty acid, vitamin E, those things also help, and this is the conservative part. And if necessary, we go for some local medications, some topical medications like minoxidil solutions. This is actually a vasodilator, but it increases the hair growth because of it increases the hair vascularity and nutritional factor. And these are specifically useful for those hereditary hair loss, male pattern or female pattern hair loss. And after that, if it is not helping the patient, then we go for PRP. PRP is a very advanced technology. This is platelet rich plasma. We inject the blood which is concentrated, and from where we extract, actually it is from the patient's blood only, we take it into some reagents and we concentrate it, we separate the platelets, we concentrate it, and we extract the beta fibroblastic growth factor from it, and then we with some reagent we inject it into the scalp, so that the hair follicle actually gets extra nourishment and the hair follicle will grow. So when the hair follicle is not taking proper nourishment or is not growing properly, this PRP procedure, it actually helps quite a lot. And in advanced stages where even PRP is not helping, in advanced grade of hair fall, in advanced grade of androgenetic alopecia, and then patient can opt for hair transplant. That is the ultimate solution. But even if you do hair transplant, that is not a permanent procedure. You will have to keep on doing those things so that you can maintain a good quality of hair over your scalp.
All right. Doctor, what I have learned from the discussion is that this is a topic which we can go on, and there are a lot of discussions that we can do. So at this point in time, I'll have to wrap up the show. But thank you so much for all those valuable information at this point in time. And viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.